Morning today from a team of care providers. They say we have a crisis in area emergency rooms.
So much so, they've launched a new campaign asking all of us to make the right call. Medical reporter Liz Bonus tells us why this could be critical to you or someone you love in need of urgent care.
It's been a busy day already in this emergency room at Bethesda North Hospital, and Dr. Roderick Huff's shift is just beginning.
We've had strokes, we've had some traumas with some back injuries, we had a heart attack.
In these cases, intervention teams are on standby for transfer.
We move very quickly with those patients.
For others, however, such as Kevin, who let us follow Dr. Huff in for his ER visit, care and treatment takes a little time. Dr. Huff says he came to the right place. Kevin could not breathe.
So he actually went to an urgent care first and made the diagnosis of the pneumothorax and then was brought into the emergency room for treatment.
What's important to note, however, is that patients such as Kevin may soon be in crisis, waiting for the care they need in the emergency room. It's all because, quite frankly, Judy Hirsch says many of us use the emergency department as a doctor's office.
It's kind of a habit to just go to the emergency department because they know, well, it's open 24/7.
To find this out, experts looked at information from area hospitals. And rather than what you think, perhaps you're going to the emergency room for life-threatening injuries, they found many of us use this for perhaps urgent care that is actually not an emergency.
When we look at the reasons for why adults in Greater Cincinnati most commonly go to the emergency department, it's actually for things such as respiratory infections, urinary tract infections, or maybe headaches. And these are actually conditions that can usually be better taken care of by your primary care physician.
Hirsch is now part of a team with the Healthcare Collaborative. They're trying to get us to make the right call for urgent needs that aren't an emergency. Because frankly, we can't afford not to.
It's nearly $600 more to go to the hospital.
That cost gets passed on to your health care premiums, and those visits overwhelm those who have real emergencies.
Make the right call is to encourage people to develop a good relationship with their primary care physician.
If you don't have a primary care doctor, Make the Right Call is a new campaign with a website designed to help you find one. If you do have one, here is what your doctor wants you to know.
I'd rather have a call in the middle of the night than have an unneeded emergency room visit.
Dr. Farzad Mazlumi says don't go to the emergency room for
Sore throats, colds, mild headaches, things like that.
Dial your doctor's office first and ask for direction.
A lot of people don't have the knowledge to differentiate between an emergent condition and a family physician condition. They look things up on the internet and often see the worst possible case scenario.
You see, you need someone who knows your personal health history.
Really, the bottom line is that your primary care physician is the person who should know you the best.
In Montgomery, Liz Bonus, Local 12 News.
We do have a link to that Make the Right Call campaign Liz mentioned. Go to local12.com, click on the medical edge, and we should also mention, in the interest of full disclosure, Judy Hirsch is the wife of Local 12 News reporter Jeff Hirsch. That's what we